We will continue where we left in the previous part. Ivermectin is a semi-synthetic derivative of avermectin B1A and B1B, while avermectins are derived from Streptomyces avermitilis. It is effective against several soil-transmitted helminth infestations, filariasis, and exoparasites such as scabies and lice. It binds to glutamate-gated chloride channels found only in invertebrates, leading to hyperpolarization and paralysis of the parasite. Due to its mechanism of action, it is better to avoid using it concomitantly with drugs that enhance GABA neurotransmission in humans such as various sedatives and hypnotics. It is administered only orally and after absorption, has a wide tissue distribution and slow clearance. Generally well tolerated, it sometimes shows some adverse effects, including GI upset, dizziness and rashes. When used to treat onchocerciasis, it may cause choroiditis or retinitis. In heavy systemic infestations, it may cause a Mazzotti-like reaction, which may include fever, vasodilation, bronchospasm etc., which responds to treatment with glucocorticoids. Despite high lipid solubility, ivermectin shows low CSF levels, because of neuronal P-glycoprotein efflux. It is best to avoid it during pregnancy and infancy. Pyrantel permoate acts by inducing a depolarizing type neuromuscular blockade and paralysis in the parasite. This is achieved by inducing the release of excessive acetylcholine and cholinesterase inhibition. This increases the amount of acetylcholine at neuromuscular junction and results in increased refractory period after an initial muscle contraction, resulting in muscular weakness and paralysis. It is given orally for local action, as it is poorly absorbed. The adverse effects are generally mild and related to cholinergic activity, such as GI upset, abdominal cramps, dizziness, weakness. It may also cause skin rash and fever. Pyrantel permoate has a broad spectrum of activity. It is an alternate treatment for ascariasis and enterobiasis. The latter requires repeated doses. It is also moderately effective against hookworm infestation but requires repeated doses. An analog, namely oxantel permoate, has better efficacy against trichoeres and strongyloides infestation, and a combination of pyrantel and oxantel is used for mixed such infestations. It is not well studied in pregnant and children less than 2 years, hence best avoided. Piperazine is largely an obsolete drug. It is now an alternative drug in ascariasis and acts by inhibiting acetylcholine binding at neuromuscular junctions in parasite, rendering them paralyzed but still alive. A mild laxative helps expel paralyzed live worms. Adverse effects are mainly related to GIT and neurological, especially in people who have some degree of renal failure. It is contraindicated in pregnancy, hepatic, renal impairment, and epilepsy. Diethylcarbamazine (DEC) is the drug of choice in filariasis, tropical pulmonary eosinophilia and liasis. It induces organelle damage and apoptosis as well as disrupts membrane macromolecule transport. DEC is an active drug with an active metabolite. Urine alkalinization reduces its excretion. It is considered safe in pregnant women. The important adverse effects include those which arise as the sequelae of parasite destruction and may require pre-treatment with corticosteroids in patients suffering from heavy infestations. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!